Extra and intraoral exam starts when you greet your patient in the reception area. As you walk your patient to the operatory, assess gait and their use of their lens. Using visual inspection, assess height, weight, body symmetry, skin color, and appearance. Is the skin dry, moist, pale, or flush? Are there raised, ulcerated, or pigmented areas? Do the eyes appear yellow or red? When reviewing medical history, listen for speech patterns, shortness of breath, or hoarseness. Certain malodors of breath can indicate use of tobacco, alcohol, or oral infections such as periodontal disease or abscessed teeth. Ketosis in a diabetic patient will exhibit a fruity smell. Observe the patient's hands. Clubbing of fingers may indicate pulmonary, cardiovascular, neoplastic, infectious, or gastrointestinal diseases. Nails that grow upwards can indicate iron or B12 deficiencies. After you have completed taking your patient's vital signs, begin your extra and intraoral exam. Have your patient seated upright and have them remove eyeglasses if they are wearing them during the extraoral exam. Explain the procedure to your patient. Tell them you are feeling for any unusual swelling. Ask them to let you know if they feel any tenderness or pain. Healthy lymph nodes will not be palpable. The 4 types of palpation used in the extra and intraoral exam are digital using 1 finger, bidigital using 2 fingers of 1 hand, bimanual using 2 hands to assess the same area, bilateral using 2 hands to compare areas on either side of the face. Put on your safety glasses and mask and wash your hands. Gloves are optional for the extraoral exam. With the anterior border of the mandible, using bilateral palpation, roll the tissue over the border of the mandible, proceeding toward the angle of the mandible. Then palpate the anterior auricular lymph nodes, which are in front of the tragus of the ear. Then proceed to the posterior auricular lymph nodes, which are located behind the ears. Lifting the hair if necessary, palpate the occipital and neutral lymph nodes from the hairline to the base of the neck. Using bilateral palpation, have the patient open and close to check the masseter and temporalis muscles and the temporomandibular joint. Do this from the back and then from the front of the patient. Observe opening and closing and side-to-side movements of the jaw. Ask the patient if they feel any tenderness when opening or closing. Note any deviations or limitations on opening. Listen for sounds or crepitus on opening and closing. A stethoscope can also be used for auscultation of the TMJ. Also using bilateral palpation, palpate the parotid glands, feeling for any swelling. Start anterior to each ear, move to the cheek area, and then inferior to the angle of the mandible. Next, palpate the submental lymph nodes and sublingual salivary glands located under the anterior border of the chin. Then, the submandibular lymph nodes and salivary glands located under the posterior border of the chin. Have your patient turn their head to the side and locate the sternocleidomastoid muscle. It will extend from the mastoid process at the base of the skull to the sternum. Then have your patient turn their head back and palpate the entire length of the muscle using bidigital palpation on either side of the muscle. To palpate the thyroid, have your patient tilt their head up and to the side, and with one hand push the thyroid to the opposite side of the neck and palpate with the opposite hand. Then have them tilt their head to the other side and do the same thing again. This gland has two lobes lying against and around the trachea and larynx. To assess the function of the larynx, have the patient swallow, making sure the larynx rises with swallowing. Using bilateral palpation, palpate the supraclavicular lymph nodes. These nodes are superior to the clavicle. To begin the intraoral exam, have your patient in a supine position. Have them put on safety glasses. If you wore gloves for the extraoral exam, remove them, wash your hands, and put on new gloves. Do a visual exam of all intraoral structures using your mirror and light before you inspect and palpate individual structures. Start the intraoral exam by inspecting the lips, vermilion border and zone, labial commissures, philtrum, and tubercle. Use bidigital palpation to palpate the upper and lower lips. Now inspect the maxillary and mandibular labial mucosa, noting the labial frena attachments. Palpate both the maxillary and mandibular alveolar ridges with bidigital palpation, feeling for any swelling. Next, observe and palpate the buccal mucosa using bidigital palpation. Assess salivary flow from the parotid gland by drying the parotid papilla with a 2x2 and then evaluating saliva flow. Observe and palpate the retromolar pads. The retromolar pads are dense tissue located behind the most posterior mandibular molars. Then observe and palpate the maxillary tuberosities. The tuberosities are prominence of bone located behind the most posterior maxillary molars. Inspect the pterygomandibular raphe. Have the patient raise their tongue and inspect the ventral surface of the tongue and the floor of the mouth. Inspect the lingual frenum, the sublingual caruncles, the sublingual fold, and Wharton's ducts. By manually palpate the sublingual and submandibular salivary glands by placing one finger in the floor of the mouth and the other hand under the chin. Compress the tissue between your fingers, feeling for lumps. With a moistened 2x2, grasp the tongue and pull it to one side to inspect the lateral border. Use your mirror to inspect the posterior lateral border of the tongue. This is the most common site for oral cancer. Digitally palpate the lateral border. Inspect the folia papilla and lingual tonsils if present. Then bidigitally palpate the tongue. Inspect the papilla, foramen cecum, and the sulcus terminalis. Digitally palpate the hard and soft palate. The soft palate can be palpated with a firm sweep. Inspect the incisive papilla, the rugae, and the median palatal raphe. Depress the tongue with your mirror and have the patient breathe through their nose. Inspect the uvula, anterior and posterior tonsillar pillars, palatine tonsils, and the pharynx. You have now completed the extra and intraoral examination on your patient.